everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication typically used for cholesterol treatment. This medication is called Rosuvastatin. Its brand name is Crestor. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Rosuvastatin is a selective inhibitor of HMG-CoA. This is the rate-limiting enzyme in cholesterol synthesis. Its lipid-modifying effect result from its ability to upregulate LDL hepatic receptors. This enhances LDL uptake as well as catabolism of LDL. There are several different indications for rosuvastatin. The first and most common would be in the treatment of hyperlipidemia. It can also be used to treat hypertriglyceridemia. It can treat mixed hyperlipidemia, as well as familial hypercholesterolemia. It can treat generalized atherosclerosis and familial type 3 hyperlipoproteinemia. And finally, we can see this medication used following several cardiovascular disorders, such as a heart attack. Now, before somebody was to use rosuvastatin, there are a couple contraindications that they must clear, as well as warnings and precautions that they should be made aware of. So rosuvastatin will be contraindicated in acute liver disease. This would also include persistent, unexplained elevations in liver transaminase levels. It should not be used during breastfeeding. It would be contraindicated in individuals who have a hypersensitivity to rosuvastatin. And finally, it cannot be used in pregnancy. Now, in terms of precautions, rosuvastatin should not be used with the medication gemfibrozil, and if they are to be used together, dose adjustments may be necessary. Increases in patients' serum glucose levels, as well as their A1C, have been reported, and sometimes these increases are past the threshold for a diabetes diagnosis. Liver failure has occurred in patients who were using rosuvastatin. An increase in serum transaminase levels, up to 3 times the upper limit of normal, have been reported. Monitoring would be very important in this situation, and discontinuation of therapy may be necessary. Patients who use metformin who also have alcoholism or a history of chronic liver disease may be at an increased risk of experiencing hepatotoxicity. Myopathy, as well as rhabdomyolysis, with some cases of kidney failure, have been reported with rosuvastatin. The rate of functional decline could potentially increase in patients who have ALS and use metformin. Unexplained but persistent proteinuria as well as hematuria have been reported with rosuvastatin. This would typically be more common if the patient was using a dose of 40 milligrams or greater. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start using rosuvastatin, they can expect to take it in tablet form. Patients are using rosuvastatin because they have a cardiovascular disorder, so sometimes this could be prophylactic treatment. You can expect an initial dose of 10 or 20 milligrams taken once daily. In terms of maintenance therapy, patients can receive anywhere from 5 to 40 milligrams. However, we do try to reserve the 40 milligram tablet for people who don't reach their LDL goal using the 20. In general atherosclerosis, the dose would be the same. So you would start off on 10 or 20 milligrams once a day and then increase anywhere up to 40 milligrams. When people are actually taking these tablets, they can take them with or without food. Oftentimes, physicians will assess lipid levels 2 to 4 weeks after starting therapy. If somebody is using one of the capsules, they should not be split or chewed. They must be swallowed whole. However, they can be opened up, and the beads inside of the capsules can be dumped onto something like applesauce or pudding. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using rosuvastatin, so I'll go over some of those here with you now. Abdominal pain happens to about 2.4% of patients. And nausea seems to happen in about 6.3%. Myalgia or muscle pain happens anywhere from 2 to 13% of the time. Headaches happen anywhere from 3 to 8.5% of the time. Now, some serious side effects, so one in terms of endocrine side effects, would be that diabetes mellitus has occurred in patients using rosuvastatin. You can expect to see this about 2.3% of the time. In terms of gastrointestinal serious side effects, pancreatitis has been reported with the use of rosuvastatin. An increase in liver enzymes or liver failure is possible. I did mention that rhabdomyolysis may occur in some people. And we also mentioned proteinuria as well as hematuria. Proteinuria could happen 1.5% of the time, and hematuria could happen 2% of the time. That's all we're going to talk about today with Rosuvastatin or Crestor. As always, I'm thankful that you took the time to come by and watch one of my videos. If you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Alright, that's it for today. Take care.